Good afternoon, and thank you for joining us today. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and County Executive Crowley, we'll start with you today.
Well, thank you so much, Catherine. Good afternoon to everyone. So yesterday, the Milwaukee County Senior Centers reopened for the first time since the beginning of the pandemic. And our staff and our customers were happy to be back and see the new changes that we have made in the interior of our buildings during the COVID pandemic. And we welcomed more than 125 community members back across all of our county senior center facilities. And as we see vaccination rates rise, we want to offer our older adult population safe places to socialize, but also to receive vital services. And we recognize that senior centers play an important role in serving our elderly population, as many of them have struggled with isolation during these unprecedented times. But we appreciate our staff and our seniors for adhering to our COVID-19 guidelines while at the facilities yesterday, which includes wearing a mask, practicing physical distancing, and following stringent cleaning practices. And so we are committed to the health and safety of Milwaukee County. We will continue to monitor and practice safety measures that mitigate COVID-19 in these spaces to really ensure the support for those who utilize our senior centers. And I'm also, happy to report that the interest that we've seen in our Healthy Homes initiative is encouraging. Making the vaccine accessible to individuals who have difficulty leaving their home is a critical component and getting life-saving shots in more community members' arms. And since the launch of the Healthy Homes program last Thursday, more than 30 people have signed up or registered for a loved one to receive the vaccine. And we know a lot of folks have already received in-home vaccines from our partners in health, but we also know vaccines are still needed for this particular population. And we're happy that the interest that we have seen thus far, and we know that these appointments will take longer to complete. So it's important that our mobile teams take the time to not only provide education and resources, but answer individuals' questions about COVID-19 and the vaccine. And our teams are also prepared to connect individuals with other resources and services as needed. And this is a population that has been largely isolated during COVID. And this personal outreach has been a good touch point with individuals checking in on their well-being and connecting people with more resources in the community. So if you or a loved one have had difficulty leaving your home and want to get vaccinated at your place of residence, please visit healthymke.com, or you can call your local health department. And I also want to remind folks that in accordance with the new CDC guidelines, masks are not required outside for those who are fully vaccinated. So as the weather gets nicer, and we hope people take advantage of the outdoors in our beautiful Milwaukee parks and waterfronts, for indoor settings, though, Milwaukee County still is requiring fully vaccinated and unvaccinated people to wear masks. Milwaukee County operates many services within settings called out by the CDC. So when you think about the jail, the House of Corrections, the hospital run by the Behavioral Health Division, our public buses, the airport, and our court systems, we serve some of the most vulnerable individuals in the community. So the risk of transmission indoors is significantly higher, and we want to ensure our services remain accessible, but also safe to all the members within the public. And yesterday, I also had the pleasure of visiting a Milwaukee County Transit System to check out the new air filtration system that they've been using on the buses to help prevent the spread of any airborne viruses, but the one that also includes COVID-19 as well. And so the introduction of this innovative air filtration treatment system is just one of the latest tools that we're using to keep our employees and our riders safe. And it is an investment in equity to keep our fleet safe and available to service residents that rely on county's transit services every day. So we are excited to see this additional layer of protection being implemented, but I will say that this does not change the current regulations for our Milwaukee County transit system. We still have a maximum of 20 passengers that are going to be allowed per bus, and masks are still federally mandated on public transportation. But we're confident that this new air filtration system paired with other mitigation practices will improve the protection of everyone in our community that uses these buses. And then lastly, it's Healthy and Safe Swimming Week. So I'd like to remind everyone to be safe while enjoying all of our beaches. So with the holiday weekend approaching, I want to encourage everyone to really get outside, enjoy it, enjoy the weather, have fun. But please remember to be respectful of others by physically distancing at our lakefronts. And with that, I'd like to say thank you and pass it over to Mayor Barrett, because we've had a great partnership. And I want to say thank you.
Well, thank you very much, Mr. County Executive, and we've enjoyed working very closely with you and your staff as well. Well, it was roughly 10 days ago that the CDC made its announcement pertaining to masks, pertaining to vaccination. And it was because of the dramatic effectiveness of vaccinations that a lot of these changes are taking place right now. And so the exclamation point that I'm going to continue to put on this is just how effective these vaccinations are and how much they have helped our community, the state of Wisconsin, and this entire country. All you have to do, tragically, is look at places like India that don't have access to the vaccinations, the vaccines that we have. And you can see just how important it is for those of us who have access to these vaccines to take advantage of this. We also see it in the numbers. I'm pleased to share that the COVID-19 cases in Milwaukee continue to trend downward. The 7-day average of cases per day for the city of Milwaukee was in the 40s last week. In the first 2 days of this week, it has been in the 30s per day. That's a significant reduction in the number of cases that we are seeing. But we're going to continue to put our major effort on vaccinations because we need to get those numbers grow. I've seen the numbers nationally in the number of states that are ahead of us and certainly ahead of our community. And my competitive juices get flowing because I want us to do a better job, and we're trying to do everything we can. And I think we have seen the different chapters, if you want to call it that we've read as we've gone through this. We started with the huge center at the Wisconsin Center, added the Northwest, Southside Health Centers, and now we're really in full throttle in getting it into the community. That means that our victories are not measured by 1,000 vaccinations per hour or day. They're measured by dozens. And so for us to get 30, 40, 50 vaccines at an outing is a good thing because it shows you the incremental progress that we can make. But there are a number of people who are not yet vaccinated, and we are all working together to address that. So, for example, as I said, we are taking vaccine clinics to all parts of the city so that access is easy. We're also working with partners, any partners we can, to answer questions and overcome misinformation. And we are consistently talking about the effectiveness and safety of the COVID-19 vaccines. We saw even more in the news today about how incredibly effective they are with children. So people have to remember the vaccine works. It's proven, and the more people who get the shot, the faster we can move forward. So our community vaccination efforts for this week include today at Mason Temple Church of God in Christ, located at 6098 North 35th Street, which will be offering vaccinations from 4 to 7 p.m. Also today on the south side at the Prince of Peace, located at 1114 South 25th Street, we'll be offering vaccinations to the public from 2 to 4. Tomorrow we'll be on West Lisbon, just near Washington Park, over at the United Methodist Children's Services of Wisconsin. That's at 3940 West Lisbon, and it'll be offering vaccinations from noon to 4 p.m. And further north on Villard will be at Ascension's All Saints Family Health Clinic, which is located at 2400 West Villard, and we'll be offering vaccines from 1 to 5 p.m. As usual, our vaccinations continue to be available at the Northwest and Southside Health Centers, as well as the Wisconsin Center, which will be offering its last day of vaccinations this Friday, May 28th. And I have been so grateful to all the individuals who've been there. I've been grateful to the FEMA team, to our health department employees. It has been a resounding success to have it there. But again, now we're moving more towards penetration in the community. Anyone who is unable to complete their vaccine series at the Wisconsin Center before May 28th, in other words, you got your first shot there, but it'll be closed when your second shot is due, you'll be directed to the Northwest and Southside Health Centers for that second dose. Commissioner Johnson will share some other vaccination partnerships taking place this week later in the briefing. I just, prior to this call, got off another call with the White House and the U.S. Conference of Mayors, where we continue to get more and more information about the American Rescue Plan Act. But it has certainly, as we all recognize, provided significant resources to local governments. And we're continuing to work on our plans here in Milwaukee to direct the money to the most significant needs. One of those needs clearly is giving our young people something positive to do in the summer. So I'm actively working with our partners to see how we can get in operation this summer more and more positive activities for the young people. That's very, very critical. I think we all recognize how critical that is. But in the coming weeks, we plan additional public meetings to share ideas and listen to Milwaukee residents who want to offer their perspective and ideas. So we'll have more on those meetings soon. And with that, I'm going to turn it over to Dr. Weston. Dr. Weston.
All right. Good afternoon. Thank you, Mr. Mayor. First to our numbers. We're currently seeing in Milwaukee County an average of 61.3 new cases a day and about 1 death every 2 days. We continue to see encouraging downtrends in our burden of disease. On the 1-year anniversary of the murder of George Floyd, we of course reflect on racism and equity in our country. But we know that George Floyd is one tragic example of a much larger issue that has persisted in our country for centuries. And while the theme of these briefings is the COVID pandemic, racial equity is not a separate issue, but one that has been interwoven with the trajectory and the impact of this virus over the last 16 months. We saw our communities of color suffer the initial burden of disease as well as death, and now we see a lower rate of vaccination. Even with the progress that we've made in reaching out to communities of color, we see that while 49% of our white population has received at least 1 dose of vaccine, only 32% of our Hispanic population and 24% of our African American population has done the same. So what do these lower vaccination rates in our populations of color mean? So to understand that, we can review a simple statistic from the Cleveland Clinic. In Ohio, since January of this year, 99.75% of people hospitalized with COVID were unvaccinated. It's 99.75% of hospitalized patients with COVID were not fully vaccinated. It's an astounding number and an example of both the importance of getting the vaccine as well as the risk of not. In other news today, we heard that Moderna studied their vaccine on nearly 4,000 children between age 12 and 17 and found in initial review that not only did the vaccine provide a robust immune response, but like Pfizer, it appeared to have an efficacy of 100%. None of the children who received the vaccine got sick with COVID. So FDA authorization for Moderna in that age group will be expected in June, and it would join Pfizer as another choice for the 12 to 17-year-olds. And while we've seen many kids in this age group getting vaccinated, we've also heard from parents who are hesitant to vaccinate their children. One of the common discussions I hear from parents is, they say, I understand that it's important for the community to vaccinate as many people as possible. Is it worth it for my child who would likely not get very sick from COVID? So now this is true. While some kids certainly get sick from COVID, most do not. The acute symptoms of COVID in children are usually mild. But I'll tell you that what worries me with children and COVID are the unknowns. We continue to learn more and more about this virus, but we must remain humble. There are so many things that we still don't understand. Many viruses have long-term effects, and we've certainly seen this with COVID. The long-term effects can have negative impacts and long-term damage to your heart, your lungs, your brain, your blood vessels, among many other parts of your body and organs. So while COVID may not make your child sick in the short term, we're just beginning to understand how it may affect them in the long run. The vaccine, on the other hand, was designed to be safe. It was designed to train your immune system and then break down and leave your body. And we have evidence from decades of vaccines to show that we should have very little concern for long-term effects from the vaccine. So taken in balance, the risk of COVID to your child is much, much greater than any possible risk from the vaccine. The choice is simple. Just as you vaccinate your child against measles, mumps, and hepatitis, so too should you vaccinate them against COVID. And as always, you can visit healthymke.com to find a site vaccinating children near you. One of the sites, Milwaukee, on top of the Wisconsin Center, Milwaukee County's Kosciuszko Community Center vaccination site, at the end of this week will close as we transition efforts of vaccination from large-scale sites to more concentrated outreach to the community. So we will still offer Johnson & Johnson to walk-ins and those who register appointments through our last day on Thursday. Thank you very much and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As the mayor mentioned, this Friday, May 28th, is the last day for the FEMA mass vaccination site at the Wisconsin Center. I want to thank the Milwaukee Health Department staff, FEMA, all of our federal partners, and the Title X soldiers who staffed this site over the past few months. The Wisconsin Center opened on January 12th, received federal funding and assistance on April 6th, and we have administered nearly 140,000 doses at that location. I'm incredibly proud of the work the staff at the Wisconsin Center have done to vaccinate the city of Milwaukee and southeastern Wisconsin. As a reminder, anyone can still utilize the Wisconsin Center for their first or second dose this week. Those who receive their first dose will be scheduled for their second at either the health department's Northwest Health Center or Southside Health Center. In addition, this Friday is the second dose day for hospitality vaccinations. Those hospitality workers who received their first dose on May 7th should plan to return for their second dose this Friday. And as an incentive, Visit Milwaukee will award 2 lucky winners $500 upon completion of their vaccination series. Businesses have been successful offering incentives to encourage individuals to be vaccinated. This week, we have 2 more vaccine incentive opportunities. Tomorrow and Thursday, the Milwaukee Brewers will host vaccination clinics before their games against the San Diego Padres. Tomorrow, vaccines will be available from 4:10 until 6:30, and on Thursday from 9:10 a.m. until noon. Everyone who's vaccinated at the clinic station at Hellfair Field will receive 2 free tickets to that day's game. We're thankful for the Brewers' generosity and hope to see many Brewers fans take advantage of this opportunity. On Thursday afternoon from 4 until 8 p.m., North-South Club at 230 East Pittsburgh Avenue is hosting their Axe COVID event. Anyone who receives their vaccine during this mobile clinic will also get a free game of axe throwing or shuffleboard. Vaccinating Milwaukee residents continues to be an all hands on deck effort, and we're grateful to community organizations, businesses, and places of worship for stepping up and helping the health department get vaccine in arms across the entire city. Our most recent data show us that 48.6% of Milwaukee residents over the age of 16 have received at least 1 dose, and 41.5% have completed their vaccination series. This number continues to grow every week, and we're hopeful that these incentive programs and additional mobile clinics will continue to move us forward. Finally, I want to remind everyone that the health order and mask ordinance remain in effect until next Tuesday, June 1st. Please continue to wear your mask regardless of your vaccination status and be respectful of businesses as they enforce these safety precautions. Beginning next Tuesday, businesses may still choose to enforce their own mask policies, and we ask people continue to be respectful and courteous of businesses' individual policies. Thank you.
Thank you, Commissioner. Our first question is for the mayor and the county executive, and it comes from Drake Bentley with the Milwaukee Journal-Sentinel. He asks, some believe unvaccinated populations are actually in a surge right now, despite the strides in vaccinations. The Black population is only about 20% vaccinated in Milwaukee. Mr. Mayor and Mr. County Executive, does it concern you that with the Black population very under-vaccinated, is it an appropriate time to roll back COVID safety measures?
Well, again, we're not rolling back COVID safety measures. What we're doing is we're putting an emphasis on vaccinations, because I think every one of us recognizes, those of us who have followed this for the last 15 months and have seen the dramatic improvements as a result of the vaccinations, know that the winning recipe, the secret sauce in this pandemic right now are vaccinations. And so we know that there are also different reasons that different people are choosing not to get vaccines. And so I think those of us who are working on this at the city feel very strongly that the best way for us to be effective is to do everything we can to partner to get more vaccines. And that means taking it literally into the community so people can get the shots.
And just to piggyback off of that, I would say that we aren't rolling back any of the COVID measures. You still have to wear a mask inside all the county facilities, and many of the facilities that we have and entities that we're in charge of are still federally mandated when it comes down to masking. But I would say that I think we're not only concerned for the Black population, we're concerned for many populations. as it relates to not reaching the numbers that we want to be able to reach. Hopefully that 70% herd immunity by July 4th that the president has talked about. So it just lets you know that we still have a long road ahead of us and making sure that we can continue to make sure that folks are safe, not just within the city, but across Milwaukee County. But we need to make sure that we continue to educate the public. So when we think about COVID-19, it just doesn't become an issue for people of color. So we have to get the information out there.
Thank you both. And the next question is for the mayor and the county executive, and it comes from Kent Wainscott with WISN 12. He says, can you share your thoughts on the decision to postpone a showcase summer event, the July 3rd fireworks, and the staffing shortages that contributed to that?
Absolutely. So when you think about right here in Milwaukee County, we do have a shortage of Parks Department staff. And so we don't have the capacity to actually pull this event off in a safe manner. So that is one of the reasons why we decided to postpone or cancel the July 3rd event.
Thank you, County Executive. The next question is from Rose Schmidt with CBS 58, and it's for the Commissioner and Dr. Weston. Are you still seeing the vaccine numbers increase daily? And how will the closing of the Wisconsin Center impact this? What strategies will you use going forward?
So we do continue to see our vaccine numbers increase daily. We'll have new data out on Thursday on the dashboard, but we do continue to vaccinate people, just not at the high rates that we were a month or two ago. As far as closing the Wisconsin Center or closing Kosciuszko Community Center, this is really a transition in efforts. It's a transition from having large-scale sites where people come to us in the hundreds and in the thousands to get vaccinated, to having more focused efforts, whether those are in grocery stores, in libraries, in parks, in community centers, reaching out to people where they are, informing them of the importance of receiving the vaccine and administering it in a convenient way.
And I can speak to the Wisconsin Center closing. As Dr. Weston said, this is really just a transition, a new phase that we're moving into. So at the Wisconsin Center, we don't have large numbers coming anymore for those first doses. And we are really heavily focused on our mobile sites and those community sites. So we have actually 265 community clinics scheduled through the end of the summer and are adding to that number every day.
Thank you both. Our next question comes from Spectrum. They're wondering, we saw the White House announce today that the country is set to hit 50% fully vaccinated people today. How far would you say Wisconsin is from hitting that point?
So right now on first doses, Wisconsin is at 47% of the population who's received at least one dose. Those numbers do continue to rise as a state every day. It's a slower rise than we saw again a month or two ago, but it's a steady rise. So I think in the near future, we'll hit that 50%.
Our next question is for the county executive, and it's from Brendan Cullerton with CBS 58. He says, County executive, can you talk about if you think the staff shortages will be solved as it relates to the July 3rd event for next year? And do you think this really will be possible to have the event next year?
A great question. So we have to recognize that, everything was shut down last year. So many of the people who work within our parks departments pretty much ended up finding jobs last year. And it is my hope that we will be bringing back the July 3rd fireworks next year. And hopefully we'll have this solved by then.
Thank you, County Executive. Rose Schmidt with CBS 58 is wondering, will masks be required at Summerfest and the state fair this summer?
So I can speak to Summerfest. It's really up to the organizers of these events to determine what their own masking policies are going to be.
I'm seeing the last question right now is from Dan Malloy with Spectrum News for the mayor. Where specifically has the city made progress in the year since George Floyd's murder led to protests calling for accountability and reform? What efforts have been sustained demonstrations had on policy?
Well, certainly the Fire and Police Commission adopted the 8 can't wait, the 8 measures that have been called for nationally. And the Fire and Police Commission acted relatively quickly to do that. So I would say that that was probably one of the most visible things that you have seen. Other things that have been called out for, actually, the city of Milwaukee has been ahead of. For example, some communities are now starting to get the cameras, the body cameras for police officers. That's something that we have had for a long time and will continue to have it. But I'm very, very cognizant that we have a long way to go, that there's a lot of work that needs to be done in America to improve police-community relations.
Okay. A final question here from Sari Lesk with the Milwaukee Business Journal. Who, if anyone from the mayor's office and health department, are expected to appear at the committee hearing tomorrow for the COVID-19 restrictions and mask mandate lifting? What will be your message?
So I plan to attend the committee hearing tomorrow. My message is we are making decisions based on science and on the data that we're seeing in Milwaukee. And as we move forward, and we also made this decision again based on the CDC best practice, which is really put us in a position where we can't enforce an indoor mask ordinance for everyone if the CDC guidance allows for individuals who are vaccinated to be unmasked indoors. And again, we worked closely with the mayor's office, but I do intend to be there, tomorrow.
And I will have a representative there as well. And I think the commissioner really captured the essence of one of the challenges, and that is the enforceability. That it's one thing to have guidance, but it's very difficult to have enforceability when you've got different people who it would not apply to. That the CDC has made it clear that if you have been vaccinated, that you don't need, from a science standpoint, to be wearing the mask in many situations, not in all situations, but in many situations. And so we have felt that it was the businesses and organizations who would have a better sense of their clientele or their visitors to know whether it was the right decision for them to make. And as we stated last week, if those organizations make that decision, we're going to be supportive. But we have been very, very proud over the last 15 to 16 months that we have followed the science at every juncture, and we're going to continue to do that.
Thank you both. Those are all the questions I'm seeing in our chat. So that concludes today's briefing. Thank you all for joining. Thank you, media, for the questions, and we'll see you on Thursday.
Thank you very much.
Thanks, everybody.
Thank you.
Take care.